I'm Dr. John McIntosh, the Founding Director of the Global Occupational Health Service Bcerta, and I'm the Territory Manager for Southeast Asia and Australia. We have been providing occupational health services for over 20 years and are the leading provider in central Queensland, as well as providing services globally to around 54 other countries using our cloud-based system. Recommendation 13 of the SIM report suggests that an electronic system should be used for the medical within the Coal Workers Health Scheme. BENE, the Bcerta Electronic Network Engine, can provide exactly that and is a potential solution that is immediately available. BENE is a purpose-designed medical software system that solves all the major problems faced by the Coal Workers Health Scheme and most of the issues raised by the SIM report. BENE has been specifically designed for occupational health services by occupational health physicians to organise, track and store workers' medical information. It has also the ability to track environmental, mine site and occupational hygiene monitoring. BENE also has the structure to provide training, upskilling and assessments of doctors who are working as NMAs. The system also is able to be used for auditing, compliance, quality control and security access control. It allows access for approved staff from any site internationally, so reporting of files internationally is solved without the records ever having to leave the secure site. All international security and medical standards have already been addressed because the system is already operating internationally. The system is stable, secure, and has been operating flawlessly for 5 years around the world. BENE provides an ideal way for auditing by the Department of Natural Resources and Mines to monitor and audit quality at every level. Automatic triggers can be created and parameters that are out of range can be specifically highlighted for review. As a medical record, BENE provides a long-term record of every single worker under the scheme, including tracking their work histories and work sites. This allows their long-term risks to be tracked, which is a very important feature for the Coal Workers Health Scheme. This system also overcomes many of the existing problems that are faced by NMAs. All of the workers' past medicals are immediately accessible, so NMAs can see all the progress or deterioration over time. This is especially important with black lung, because early detection of falling spirometry results will highlight the presence of black lung even before the result is out of the normal range. Inappropriately repeated tests like X-rays can be avoided because all recent X-rays and results can be seen by the NMA. Because the system is cloud-based, results are immediately available by the company, HSU and NMAs as soon as they are recorded on the system. This also eliminates all manual handling for the NMA and the HSU staff, so reduces costs across the board. This system also eliminates the possibility of lost or missing reports. BENE is also set up to automatically contact the next provider in the process, so they can then log onto the system and perform their task. So for example, if one doctor performs examination only, this system then forwards the medical onto the NMA for that company's NMA to sign off the section form. If US readers are required, they are emailed to log on and review their files, approve them and then move the medical back to the NMA for approval. There is no transfer of files to the US. The US readers just log on to the BENE system, produce their report, which is then stored and the medical returns to be signed off by the NMA. The output report, when completed, is automatically sent to the HR staff of the mine. In summary, there is no transfer of files outside of the system at any time, with all providers logging onto the system to complete their tasks. This includes the US X-ray readers, and as a result, the security and integrity of the workers' confidential data is never compromised. The workers' medical record can follow them to their next mining employer, and this maintains the continuity and improves the quality of the medical decisions made by the NMAs. If the worker ceases work, their file will be archived and reactivated whenever they are re-employed under the scheme. These archived files can also be used to track long-term risk from the coal industry for long-term risk monitoring. Training. Online help buttons can provide standards of the scheme to improve the compliance at every level for the NMAs. BENE can also be used to provide online training and assessments of NMAs should that be required. This overcomes the tyranny of distance, and the system can exclude NMAs until they have complied with the training requirements. This system is extremely cost effective and could be installed very rapidly once approved because it is already fully operational. Bcerta Australia is 100% Australian owned, and we are also joint owners of Bcerta globally. BENE is the world-leading system for cloud-based occupational health services and is ideally suited to the Coal Workers Health Scheme, solving all the major problems of the Coal Workers Health Scheme for the Department of Natural Resources and Mines and for the doctors working within the scheme. Please contact us for a more detailed demonstration of BENE and see the advantages for yourself. I'm Dr. John McIntosh. Thank you for your time.